Good morning, friends. Today we are discussing about the Losartan. Losartan is a angiotensin receptor blocker. It is a competitive antagonist and inverse antagonist. It mainly affects on the 81 receptors, more than 82 receptors, nearly 10,000 times more selective for the 81 than the 82 receptors. Has also some act on the thromboxane A2 receptor, which is lead to the some platelet anti-aggregatory property, which shown by the Losartan. All overt action of angiotensin 2 are as follows: as vasoconstriction, release of aldosterone, adrenal from the adrenals, renal action promoting salt and water reabsorption, central actions like thirst, vasopressin release of growth promoting actions on heart, blood vessels are all are blocked. These are the mainly all overt actions of the angiotensin 2, as I mentioned below. And next, Losartan causes, it mainly causes on the fall in the BP in hypertensive patient, which lasts for the 24 hours, but it never ever effect on the heart rate and the cardiovascular reflexes. So remember the point that Losartan mainly affect on the heart, on fall in the BP in hypertensive patient, but it never effect on the heart rate and cardiovascular reflexes, and no significant effect on the plasma lipid profile, carbohydrate tolerance, and insulin sensitivity. It means it does not affect on plasma lipid profile, carbohydrate tolerance, insulin sensitivity, but it mild probenicide like uricosuric action produce, like it mainly help eliminate uric acid in the urine. The probenicide drug like actions. And next about is pharmacokinetics. Oral absorption is not affected by food, and bioavailability is only 33% due to the first pass metabolism. You know the first part I think, I hope you know the first pass metabolism. Partially carboxylated liver to the active metabolite. You should remember the E3174 is the active metabolite of Losartan, which is 10 to 30 times more potent competitive 81 receptor antagonist. And Losartan do not enter brain and excreted by liver. So remember the point that it does not cross the blood-brain barrier, and it does not reach the brain, but it is excreted by kidney. Plasma T half is 2 hours for the Losartan, but plasma T half is 6 to 9 hours in its active metabolite, that is E3174. Next point about this one is there is no need to adjust the dose in renal insufficiency because it is excreted to renal, but you should reduce the dose in the hepatic dysfunctions because the metabolism takes carboxylation takes place in the liver itself. And the adverse effect of Losartan is hypotension, hyperkalemia, angioedema. Some reports shown that angioedema is also a side effect of Losartan. Headache, dizziness, weakness, and upper GI side effects are also there. And the mainly important thing is Losartan has the phytopathic potential. It means it mainly affects the fetus in pregnant women. So we don't administer the Losartan in pregnancy patients. Thank you.